that I want to do hand butterfly because this patient, I have experience with them. They said they don't want to do it, so I brought the supplies I needed. So the first thing I'm going to do is I'm going to go to my patient room, identify myself, collect some information, and go from there. Sounds good? If you have any questions, let me know. Okay, knock knock.
Hi.
Hi, Mr. Michael. My name is Mojda. I'm going to be your medical assistant today. Can I please verify your first name, last name, and date of birth?
Michael Camacho, 11594.
Oh, perfect. So it looks like you're here to do some blood draw. The provider ordered some CBC. I'm just going to go ahead and don my hands, kind of cleaning my hands and go through it. Have you ever had any blood draws before?
I have before.
Yeah?
I don't like needles.
You don't like needles?
I don't like needles.
Do you prefer sitting down, lying down?
Sitting down's fine.
Sitting down is fine? Okay. And when I do my blood draw, would you like me to go through the process and walk you through step by step? Or do you want me to
Yes,
just go ahead and
please.
surprise?
Yes,
Walk you
please.
through step by step. I got that. I got it. May I please have you to bring your arms up for me? Okay, go ahead and put both of your hands right here. Is it okay for me to touch you?
Yes.
Okay, which hands do they normally draw blood from?
I can't remember, but I'm left-handed.
You're
Can you
left-handed.
go on my right?
Okay. And any allergies that I should know of?
No.
No? To this tourniquet, gloves, alcohol
Latex,
wipes?
no.
No.
No allergies.
Just to be safe, I always have 2 different kind of wipes with me, just in case the patients are allergic or they're not aware of it, or so on. So there's 2 different wipes. I'll show you how to use this one, and safe to have it. I'm sorry, which arm did you say?
The right, please.
The right. Okay, just gonna roll this up. So I'm just gonna go a few inches. He likes me to walk through step by step, so I'm going to tell him. Few inches above the wrist, and we want to make sure to avoid the bone. So I'm gonna have you to turn around, and I want you to put pressure on this tourniquet. Go ahead and put your arm down. Don't let me lift your arm up, okay? So what I'm doing here is, I know that I don't have gloves on. I want to find the vein that I want to go for it. So looking like right straight, he has pretty good veins. I don't look, I palpate. But let's just say the veins are not popping up. I'm going to go ahead and have you stand up, Mr. Michael. And then make a tight fist for me. Swing your arm a few times around. The rule is 60 seconds for the tourniquet, but sometimes your patient's veins are not popping up, so you got to come up. That didn't work either. Oh boy. What I'm going to do, I'm going to go ahead and get a warm heat pack for you. Okay? I'm going to bring my heat pack, put that in the back of the hand, and that's another method. You don't have a heat pack. What else can I do? I'm bringing to the sink. Start the warm water. Have him hold his arm under the warm water. Different methods you can work. No.
No,
Make
not
a
with
tight
the
fist?
tourniquet.
No. Go ahead and tight fist. Beautiful. So I feel pretty good. I'm going to go. The bigger, the juicier, the easier they will roll.
Yeah, I don't know if you
Okay.
guys see this. See that?
I'm just going to open that.
Yeah.
Okay, that's gonna roll. So I know which vein do I want to go. I'm gonna go for that one. It's a little bit challenging, so I can show you how to anchor very, very tight. From here on, I'm just gonna go ahead. You can put your gloves on if you want, but I'm gonna double clean. I like cleaning, so I'm gonna show you this one. You're gonna just twist it, and you're just gonna breaks it. Start from the circle and work your way out. Never hurts to clean 1, 2, 3, 4 times. Never ever. This is done. Now I'm gonna let that dry. I do not want to put the tourniquet on, right? So I'm just gonna go ahead and put my gloves on here, Mr. Michael.
Okay.
Yes.
Why are we do we only draw from their hands if we can't draw from their...
No.
Okay.
If you can draw from AC, you always go AC. Anticubital fossa is the best method to go. The only time you would go for the hand is when you're not really able to see any ACs. Okay? Again, you guys are learning, so you have to be prepared for any. They might be having some sort of birth control, or they might have had some injuries. You can't go on the AC, even though they have good wins. Now you know how to do on the hand, right? Okay, so I have my stuff ready right here. I'm just gonna leave this here. I'm gonna bring my gauze close to me. I'm gonna bring one more. And I like to have all my stuff prepared. May I have you to put your hand up a little bit? Beautiful, go ahead. What I wanna do is, I'm not gonna have this while my patient is putting pressure on. So I'm gonna just go ahead and have this ready right here. Okay, from here, I'm gonna go get another alcohol wipe. Again, I did not put the tourniquet, right? Because I know where the vein I want to go. I did not touch the alcohol where it touches the patient's skin. Work my way out. I know it's a little bit over going too far, but it never hurts, right? So I'm just gonna lift this up a little bit, and the same thing here. I want you to put pressure down and don't let me lift it up. Beautiful. The tighter, the better it is. And remember, this patient likes me to walk them through step by step, and the knot is away from me. I'm gonna have you to give me a few squeeze, please. Perfect. If you want, you're more than welcome to have these ready. Few methods really fast. Some people like to, for example, pretend this is a hand sanitizer. They like to put this under the patient's arm. It's not wrong, it's different. Some people like to grab the patient's hand while they're drawing the blood. It's not wrong, it's different. You're more than welcome to try it. But remember, when you're learning, it might be a little bit harder for you because you are shaking, you're learning. So if you're holding Mr. Michael's hand like this and you're poking, you might not be able to let go of his hand to grab the tubes and push that in. All right, so what I teach, every time that I teach, I'm gonna have my patient to make a tight fist and bring the opposite hand to me, make it a tight fist, and please leave that right here. You don't want their hand to be sticking up. You want the nickels to be relaxing, okay? So I'm from here, like a princess. You're gonna open. You're gonna make sure your bubble is up. You're not blocking your flash, right? I'm gonna have this ready. All right, Mr. Michael, on count of 3, I'm gonna go ahead and poke you. Can you make a tight fist for me? Beautiful. The tighter you anchor, the better it is, okay? On 3, 1, 2, 3. And there's my flash. And I'm trying to make sure that I'm not moving, I'm not shaking my hand, otherwise there's gonna be a hematoma right under that. From here, I'm just gonna keep an eye on my patient, at the same time talk to them. Let's pretend this blood got full. I'm gonna switch this.
Pay attention to
All right.
how the tubes are being held. You want gravity to do its work. So to get more blood or just to have it be more successful, don't hold it sideways, hold it straight up.
All right. So first is
Tourniquet.
tourniquet. Second,
Tube.
beautiful. Tourniquet, tube,
Needle.
needle.
Safety.
I don't trust my patient, so I'm going to do it myself. I'm going to grab my tubing and I'm going to push this up until I hear that clack. Ready?
Yeah.
Okay, straight tube.
Shush.
Never messing around, never pushing it anywhere. Now I'm going to have my patient to relax their face. Beautiful. Pretend this is all full. I don't want to suck all your blood. Okay, I'm going to put this right here. We're going to go ahead and open this. And how are we feeling?
I feel a little lightheaded.
Lightheaded. Okay, so I'm just going to wrap this really fast and I'm going to have you to lie down. So please do not stand up
Okay.
because I don't want you to fall and bang your head. So hang on tight. All right. So from here, is it okay for me to help you go to the bed over there and lie down? Okay, perfect. I'm going to go check with my provider to see if I can bring you any juice or water, but I'll leave the door open.
Okay.
Okay?
Thank you.
And if you need any help, just holler at me.
Thank you.
Now I'm going to carry my patient to put them on. They said they're lightheaded. Right? Okay. Questions? Thank you.
Ask them.